Hi, I'm Dr. Hanisah Azhari, a pharmacist and researcher in formulation science for the past 11 years. I'd like to ask everyone, how is your bowel today? Are you feeling good? Do you feel okay? Many people experience digestive health issues but keep on ignoring it. For them, it's normal. It will go away in a few days. However, these issues can persist and cause a chronic problem if left untreated. Common digestive issues that people commonly experience include constipation, diarrhea, hemorrhoids, and irritable bowel syndrome. Not many people realize that the health status of our digestive system is commonly related to bowel movement. Every person has a different habit of bowel movement. Sudden changes usually are not that crucial, but irregular bowel movement can indicate a more serious problem. Do you know that irregular bowel movement has become a common problem nowadays? We see people around us complaining about not going to the toilet or having problems in maintaining normal bowel movement. A study conducted by UKM Medical Center has shown an increase in the incidence of irritable bowel disease from 1980 to 2018. Meanwhile, based on the National Health and Morbidity Survey in 2015, 94% of Malaysian adults did not take enough fruits and veggies as recommended by the WHO. The low consumption of fruits and veggies intake may explain the higher incidence of chronic diseases, including irritable bowel disease in this country, even among patients with higher socioeconomic status. We also know that studies have shown that irregular bowel movement is associated with colorectal cancer. It is alarming to know that colon cancer is the second leading cancer in Malaysia among the males and third common in females. For some people, one bowel movement per day is normal, but for others, having several bowel movements a day or once every 2 days is normal. There is no set of specific pattern. However, significant changes in the frequency of bowel movements or the appearance of feces can indicate a problem, particularly when these changes accompany other symptoms such as diarrhea, constipation, or abdominal pain. Defecation is part physical and partly mental. If you aren't going to the toilet as easily or as often as you like, addressing certain aspects can actually help you. Simple and basic lifestyle and diet changes can possibly help to regulate the bowel movement. Important components in helping to regulate your bowel is by drinking enough water and get enough fiber from your diet. These are the two major elements that can help your bowel movements easier to pass. Constipation happens when food moves too slow through the large intestines, often resulting in hard stools that is very difficult to pass. Eating the fiber-rich foods can actually help to move the contents along the large intestines much quicker. Fiber can also help absorb the water, soften the stools so that people can pass more easily. Meanwhile, diarrhea occurs when undigested food moves too fast, even before the intestine can absorb water, and that results in loose stools. Fiber has ability to absorb this water and make the stools more solid. And by slowing the transit time, fiber gives the large intestines a chance to absorb the additional water. Fiber also helps to bulk up the contents of the large intestine and binding the undigestible food altogether. It is also important that people do regular exercise, and please do not sit on a chair for too long. And remember, never hold your toilet urge. Most people with bowel problems will resort to acute treatment. We commonly see people who frequently buy enemas and laxative like lactulose from pharmacies in order to help them to go to the toilet. Even though this seems like a fast solution, it might be creating a more harmful condition when being practiced for a long time. The use of laxative can lead to a lazy bowel where your intestine will not be able to contract normally anymore to expel the stool. And having the stool in your gut for an extended period of time will also lead to toxin accumulation in the body and cause more serious health effects in the long run. It is very important to evaluate your daily lifestyle and diet, including your fiber intake, in order to have a regular bowel movement. Have a check on your daily routine and remember that a happy bowel will lead to a healthier life.